Well, as the COVID-19 pandemic continues to spread, and whether the vaccine timeline will hasten recovery or disappoint investors, we will have one poll question to get your opinion. When do you think an effective vaccine or treatment will be rolled out to a large part of the world? First half of 2021, second half of 2021, or 2022 or later? And also the confidence among the people whether they are willing to take the vaccine even when it's being rolled out. It will be interesting to see the results from the audience. Okay, it's kind of market consensus that is second half of 2021. Will be interesting as I present our house view. At UOBAM, we have a team of economists and financial analysts who somewhat ironically have spent more time in the past 6 months reading medical papers than financial papers. And sometimes we joke around and saying they are the medical specialists now. But we think the path of the virus with the medical community's ability to counter the pandemic remains one important variable that would impact financial market over the coming year. Having spent all this time taking the medical progress, UOBAM has a positive view of the likelihood of this advancement making a difference to global economy and markets in 2021. These next few slides are a summary of where we think the progress is going to come from. And in these slides, we will highlight that the progress actually already made in reducing the case fatality rates. Second, the improvement in testing and treatments that we believe are advancing more than the market had hoped for so far. And our view that the vaccines are likely to be effective and will be rolled out in large quantity by 2Q 2021. The first thing we would highlight is that the progress is already very significant, even before some of the most promising treatment and vaccines were approved. As you can see in the chart, back in January and February, the number out of China for the case fertility rates was over 3%. Well, the definition of case fertility rate, or CFR, the possibility of dying for anyone who contracts the disease. The rate have thankfully been falling steadily. The most recent estimate by the Medical Research Council in the UK is now as low as 0.3% versus the common flu estimated at around 0.1%. So studies by other countries are getting similar numbers. So if a little more progress can be made in treatment and vaccines, and the CFR gets closer to the flu, then we are likely to be able to get our lives back and live more normally again. And a big part of the reduction in the CFR is due to the advances made in treatment. Firstly, of all the understanding of best practices in care for COVID patients have improved immensely, such as knowing now the ventilator should be avoided as long as possible, proning or getting patients to rest on the stomach, basic nutrients like vitamin C, vitamin B, and magnesium are frequently checked and given. Knowing to look for signs of blood clotting, better understanding of blood marker and oxygen readings, and knowing how and when to react to them. So probably the biggest game changer for drug has been dexamethasone, which Oxford University published the detailed study on its use for COVID-19 COVID patients back in June. it changed global treatment practices for COVID patients overnight. Dexamethasone is a steroid that can be used for, to treat autoimmune problems. That is what happened when the immune system overreacts and starts to attack the individuals. Since most of the fatalities for COVID occur when the autoimmune system is overreacting, dexamethasone has helped to counteract the most critical part of disease intervention. Other drugs such as remdesivir are regularly used for hospitalized patients, and studies show it quickens the recovery time. Remdesivir is an antiviral drug that that prevents the virus from replicating in our body. And there are more promising drugs in phase 3 trials that show a lot of promise. In particular, monoclonal antibodies and interferon beta look the most promising and could go a long way to lower COVID lethal rates. In fact, for your information, the treatment that Trump has received is a combination of dexamethasone, remdesivir, and monoclonal antibodies. The drawback is that it needs to be done, I think this slide basically shows another important step that we have taken. The advances in testing have been really important, and we think most investors don't quite appreciate how meaningful the advancement in testings are. The most optimistic look at the new testing capability as a way of suppressing COVID while waiting for a vaccine. There are 3 main types of testing being done, as we put in the table. Until recently, there were 2 types. The gold standard, which is called the PCR test. It is very accurate and is given to diagnose any patient suspected of having COVID. The vast majority of the testing around the world to date has been PCR testing. The drawback is that it needs to be done in a lab and thus slow and takes several days to get results. In places with significant outbreaks, it can take over a week. As accurate as PCR testing is, this makes it ineffective in letting people know immediately if they have caught the virus. The second major type of testing are the antibody tests. These are used to see if you have the COVID in the past. They are useful gauge to get a sense of what percentage of a community has already been exposed to COVID, but not letting that they have COVID. The new type of testing that is being rolled out now are what they call antigen tests. These tests are less accurate than PCR, but they are very fast and very cheap. Abbott, which is the medical device company, has been rolling out a fast 5-minute results test kit and also paper-based tests, as we showed in the picture. And this paper-based test work somewhat like a pregnancy test and can be done at home and can give result in 15 minutes. And they currently cost around $5, but it's expected that they can fall to as little as $1. The hope is that this test can be rolled out across the world. In fact, just for your information, the Singapore government overnight has also announced that as the country is preparing to further relax the control, and they have introduced antigen tests to basically test on a bigger crowd of people. And then people can test more regularly, and patients will catch their cases much earlier and quarantine themselves earlier. So such knowledge could go a long way to containing the pandemic and for us to go back to our normal life. Finally, and most importantly, we think the progress on the vaccines has been very encouraging. Most surveys show that investors and the population in general are fairly cautious about the near-term prospect for a reliable vaccine. It's fair to say that no vaccine in history has been rolled out so quickly, and a typical timeline would be 5 to 10 years. The breakthrough in vaccine development and excellent strategic cooperation between companies and governments around the world indicates that the world could have a safe, effective vaccine produced in large number within a year of the outbreak. In fact, currently there are more than 100 vaccines undergoing trials now. There are 9 that are in phase 3, and in the table we have listed down some of them, and several more in phase 2 trials and about to start phase 3. The preliminary results of several of these vaccines look like they have a good chance of being effective. We think the phase 3 trial will likely be completed before the end of the year or early next year. There remain many questions regarding how quickly they can be produced in large numbers, how lasting will be the immunity, and how many will take the vaccine. We think there's a reason for optimism on all fronts. Governments around the world have been paying companies to start production even before trials are complete. Current surveys have only a modest majority of people indicating that they would take the vaccine, but we think this number will improve as it becomes more common and requirement for things like attending school, for travel, and attending conference. So in conclusion, while nothing is certain regarding the rollout of treatments and vaccines, we think there is lots of room for optimism, and markets may not have fully appreciated the extent of the positive development. We think the case fertility rate, or the CFR, is already being reduced, and that it will decline further in the coming months, and probably close to the common flu kind of ratio. We think immunity is likely to be lasting, and vaccines should work and will allow people to return to more normal behavior in 2021. This will be positive for markets, and in particular, we think those sectors that have been held back will start to recover more fully. Travel and leisure in particular are among the areas that could benefit from a rebound by the end of 2021.